This is a story that changed everything I thought I knew about healing. It's a story about rhythm, neuroscience, and why the mental health system is failing millions of people. But more importantly, it's about a solution that actually works. Hi, I'm Laurel Hurst, a music professor turned psychiatric nurse practitioner, and this is how groove therapy was born and why I believe neurorestoration, real lasting healing, is possible for everyone. Despite nearly 380 million prescriptions for psychiatric medications written every year in the United States, depression is still the number 2 cause of disability. Suicide remains the number 2 cause of death for Americans aged 10 years to 34. We can't sit still on information like that. The standard of care isn't working, not because medications are bad, but because we're missing something fundamental about how the brain actually heals. What if there was a different way, one that worked with your brain's natural capacity to heal? That's exactly what neurorestoration is all about. I'm going to show you where to start. My journey started in the most unexpected place, not in a hospital or in a clinic, but in the world of music. I wasn't always a psychiatric nurse practitioner. I started as an ethnomusicologist, studying the philosophical underpinnings of rhythm and music across cultures. I earned my master's in ethnomusicology, researching gospel music, traditional drum ensembles, and the African cultural arts continuum. I was fascinated by this question. Why does rhythm have such power over us? Why can a simple drum pattern change how we feel, how we connect, how we move, and how we communicate? But there was a problem. I kept seeing people, really struggling people, who needed more than academic research. They needed real help. I was a music professor. I was respected in my field, but I couldn't shake this feeling that I was meant for something more. As a mom of 5 with 2 sons who went on to serve in the Navy and Air Force, I understood what it meant to fight for something bigger than yourself. In my 40s, I made what everyone thought was a crazy decision. I went back to school to become a psychiatric nurse practitioner. Sometimes the most radical thing you can do is follow what you know is true, even when it doesn't make sense to anyone else. That decision led me to discover something that's now changing lives every single day. And there's a free quiz that can help you understand where to start. I enrolled at the Ohio State University College of Nursing, the number 1 public university nursing program in the nation. And I learned everything I could about brain function, psychiatric diagnosis, medication management, and therapy protocols. But what troubled me, even with all this knowledge, the system wasn't designed for healing. It was designed for managing symptoms. 15-minute med checks, overbooked schedules, patients who'd been on the same medications for years with no real improvement. Healthcare providers burned out and frustrated. I saw psychologists, nurse practitioners, and healthcare executives, especially women, drowning in a system that prevented them from doing the quality care they were capable of. And I kept thinking about what I knew from my music research. The body has an innate capacity for self-healing through rhythm and movement. What if we could combine these two worlds? Your brain has a superpower, and most doctors never mention it. It's called neuroplasticity, your brain's ability to rewire itself, create new connections, and heal from trauma, stress, and dysfunction. Here's how it works. Every night while you sleep, your body scans your nervous system. Connections you used recently get strengthened with myelin, a coating that makes signals faster and more stable. Connections you haven't used, they get pruned away. This means you're literally rebuilding your brain every single night based on what you did that day. The question isn't whether your brain can change. The question is, what are you doing to direct that change? That's where neurorestoration comes in, and our free quiz can show you exactly where your nervous system is right now. Through my research and clinical practice, I discovered something crucial. Chiropractic works on your skeleton, massage therapy for your muscles, cognitive therapy for your mind, None of it truly sticks unless your nerves are primed to accept it. Your nervous system is the foundation. Without neurological integration, every other therapy is like building a house on sand. That's why people can try therapy after therapy and still feel stuck. Real healing requires neurorestoration, rebuilding the nervous system from the ground up. And understanding where your nervous system is right now, that's step one. Our free quiz can help. This led me to become certified in Blomberg rhythmic movement training, a protocol based on the natural movement patterns babies use before they learn to walk. These simple rhythmic movements stimulate nerve growth and primitive reflex integration. They help the brain make new, healthy connections to overcome developmental deficits and difficulties from infections, toxins, injury, or stress. But I knew from my ethnomusicology background that healing works better in community. In many cultures, wellness isn't a private relationship between doctor and patient. It's a community endeavor. So I asked myself, what if I combined rhythmic movement training with group drumming? And that's where groove sessions were born. Current research confirms that drumming together delivers measurable benefits. Drumming together improves mood and emotional regulation, provides anti-inflammatory effects, increases pain relief hormones, boosts neuroplasticity, brain growth and adaptation, enhances pro-social behavior and connection. And here's the best part. These benefits are compatible with all other interventions. No matter what you're doing for your mental health, drumming can help you feel even better. Drumming bypasses stigma, engages the whole body, and creates lasting change. Want to know where to start? Take our free quiz to understand what your nervous system needs most. Every time I bring a new group into a groove session, someone says they're the one with absolutely no sense of rhythm. But here's the secret. We use groovy lyrics and songs to help you play along. Think of it like drum karaoke. All the parts are supported by backing tracks, so the group sounds amazing right away. I've seen people with Parkinson's disease, developmental disabilities, severe anxiety. Everyone can move or be moved to rhythm. Your body already knows how to do this. You just need the right framework. Our free quiz helps you understand what framework will work best for you. So I developed the groove therapy model, a comprehensive approach to mental wellness that addresses what conventional care misses. It includes lowering inflammation through comprehensive assessment, optimizing nutrition for gut-brain health, integrating primitive reflexes through rhythmic movement, healing communication and relationships through drumming together, maturing thoughts and emotions with person-centered care. In 2017, I founded Groove Therapy Health and Wellness, and the Albert Schweitzer Foundation named me among the top 200 graduate student healthcare innovators in 2021. My book, Groove Therapy, Reengaging the Transformative Power of Rhythm in Communication and Relationships, became an international bestseller, and I've been recognized by the Grammy Foundation, Ohio Arts Council, and Morgan Foundation for my work. NeuroRestoration isn't about putting a Band-Aid on a wound. It's about healing for good so that wellness endures. It means addressing root causes, not just symptoms, working with your body's self-healing design, creating measurable physical, emotional, and relational changes, building resilience that lasts. This is the work I do at my integrative psychiatry practice through groove sessions and in programs like Well-Tuned Wellness. When you restore the nervous system, everything else can finally heal. Ready to start? Our free quiz gives you clarity on where your nervous system is and what support would serve you best. On average, it takes 17 to 27 years for new research to become part of standard practice. That means right now, there are proven interventions for mental wellness, like drumming, movement, nutrition, primitive reflex integration, that work. The science is clear, but most clinicians will never use them because they're waiting for the system to catch up. I don't want another generation to pass before these benefits are as common as recommendations for diet, sleep, and exercise. And that's why I created the Brain Health Hookup podcast and the NeuroRestoration Guide to shorten that trajectory. You don't have to wait for the system. Take our free quiz to see where you can start today. If you are a driven woman, maybe a healthcare professional, executive, or entrepreneur, you know what it's like to push through exhaustion. You're doing important work, but your body is screaming for something different. Unmet physical needs, unfinished emotional business, a nervous system stuck in overdrive. You've tried everything: therapy, medication, meditation, but nothing creates lasting change. That's because you need neurorestoration, a complete retune of your nervous system. Our free quiz shows you where to focus first without drudgery or perfectionism, just clarity. Here's what happens in groove sessions. You play drums together in a group. The call and response is reassuring. The repetition, traveling over the same musical ground, melts tension and fear. You feel calm, concentrated, confident. This is recreation. One groove sessions facilitator told me, I came in so tense and now I'm relaxed and energized. We need this for every staff member every week. And participants say, I thought I'd be the one with no rhythm, but this made me feel so connected. Groove therapy works because it engages your whole self, body, mind, emotions, and relationships. And these principles apply whether you're drumming or using other neurorestoration techniques. I've now trained healthcare providers, therapists, social workers, teachers, and parents in these methods. I've facilitated groove sessions in substance use treatment centers, corporate wellness programs, family therapy, and community groups. I pioneered shared medical appointments in Ohio, combining psychiatric evaluation with groove-based drumming to deliver group care that actually creates lasting change. And I've watched lives transform. People getting off of medications they've been on for decades, families healing communication patterns that have been broken for years, healthcare professionals rediscovering why they went into this field, women finding energy and clarity they thought was gone forever. Real wellness starts with 4 fundamentals: rest, quality sleep, and nervous system downtime; nourishment, brain supportive nutrition, not just calories; movement, rhythmic, primitive pattern movements; and state of mind, emotional regulation and connection. Most people skip straight to advanced interventions without building the foundation. When you address these basics with precision, your body can finally do what it was designed to do: heal. Take our free quiz to discover which foundation needs your attention first. One of the biggest barriers to mental health care is stigma. People are ashamed to seek help. They're afraid of being labeled. But what if mental wellness didn't require sitting in a therapist's office or being on medication? Groove therapy destigmatizes mental health by making it fun and engaging, community-based, physically active, creative, and expressive. Nobody feels ashamed of drumming together. When you remove stigma, you remove the biggest barrier to healing. That's why neurorestoration works for people who've never tried traditional treatment. In my integrative psychiatry practice, I do comprehensive assessments that most providers never run: inflammation markers, vital nutrition levels, omega-3 fatty acids, hormone balance, gut microbiome health. I've seen countless cases where treatment-resistant depression was actually undiagnosed inflammation or nutritional deficiency. Your brain can't heal if your body doesn't have the building blocks it needs. Our free quiz helps you understand if physical foundations like these might be the root of what you're experiencing. Talk therapy works on conscious thoughts. Medication shifts brain chemistry, but neither address the nervous system patterns laid down in early development. These are called primitive reflexes, automatic patterns that should integrate as we grow, but often don't, especially after birth trauma or complications, illness or infection, accidents, injury or toxic exposure, or chronic stress. Until you integrate these reflexes, your nervous system stays stuck in survival mode. Lasting change requires nervous system integration, not just symptom management. That's the core principle behind everything I teach. At my practice, Integrative Psychiatry Centers, we've created a different model. Out of network so we can give you more time and attention, comprehensive assessment for root causes, groove-based therapy integrated with medication management, family systems work, and relationship healing. Practitioner training for others who want to offer this care. We're proving that you can flourish emotionally, physically, and relationally when you address the whole person. This isn't fringe medicine, it's the future of mental health care. Ready to experience it? Start with our free quiz to see what kind of support would help you best. So here's what I want you to know. You don't have to accept feeling burned out, foggy, frustrated, or stuck. You don't have to settle for 10-minute med checks or talk therapy that doesn't create lasting change. And you definitely don't have to wait 17 years for the research to trickle down to standard practice. NeuroRestoration is available to you right now. It's about understanding your brain's incredible capacity for change, addressing the root causes in your body and nervous system, using rhythm, movement, and connection to create healing, building a life where you flourish, not just survive. If you're ready to learn the fastest way to a more calm, kind, and capable you, I invite you to take our free quiz. It's at quiz.neurorestoration.com. That's quiz.neurorestoration.com. It's designed to help you understand where your nervous system is right now and what kind of support would serve you best. No pressure, no pitch, just clarity about what's actually happening in your body and what might help you restore the balance you're looking for. Again, that's quiz.neurorestoration.com. This is the work that's changing lives every day. The work I teach on the Brain Health Hookup podcast, in my best-selling book, and in my clinical practice. Because mental wellness gets to be fun. Healing gets to be sustainable. And you get to live life on your terms. I can't wait to see what becomes possible for you.